वालेकुम एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज की वीडियो में हम बात करेंगे लिम्फेडिमा प्रिवेंशंस, हाउ टू रिड्यूस द रिस्क। तो फर्स्ट ऑफ ऑल हम बात कर लेते हैं, दीज गाइडलाइंस शुड बी फॉलोड बाय दोज हु हैव अंडरगो lymph node removal or radiation therapy, as they are great risk for developing the lymphedema, which may take months to year to develop. The prevention strategy listed below are designed to keep the lymphatic transport capacity at the optimal level and to prevent the excessive lymphatic loads. These guidelines refer to the affected extremity in particular, but depending on the activity may apply to the whole person. First of all, skin care. Avoid trauma injury to reduce the infection risk. Keep a first aid with you at all time to treat the minor cuts. Then protect exposed skin with the sunscreen and insert repellent. Keep your extremity clean and dry. Apply moisturizer daily to prevent the chapping of the skin. Wear gloves while doing activity that may cause skin injury. Be meticulous with nail care. Do not cut cuticles. Use care with the razors to avoid the nicks and skin irritation. Avoid puncture if the possible, such as the infection and blood draw. We use alternative sites such as the buttock and affected extremity. If scratch, puncture to the skin occur, wash it to the soap and the water. Apply antibiotics. Observe the sign of infection such as redness. If a rash, itching, redness, pain, increase the skin temperature, fever or flu-like symptom occur, contact your physician immediately for the early treatment of the possible infection. Be careful when playing with the pets to avoid scratches. Wear gloves. Do not get piercing or tattoos. Activity lifestyle. Gradually build up a duration and intensity of any activity or exercise. Second, avoid sudden heavy lifting. Third, take frequent rest period during the activity to allow for the limb recovery. Fourth one, monitor the extremity during and after activity for any change in the size, shape, tissue, texture, soreness, heaviness or firmness. Fourth, maintain optimal weight by eating a healthy diet, low salt, low fat, high fiber, lots of fresh fruit and vegetable. Then we will talk about avoid the limb constriction. First of all, avoid having blood pressure taken if possible on the limb at the risk. If the BP must be taken on the affected limb, have the practitioner take the BP manually to minimize the excessive pressure instead of using an automatic BP device. Wear loose fitting jewelry and clothing. Compression garments. Wear garments that fit well. Support the limb at risk with the compression garment for the strenuous activity such as weightlifting, prolonged stretching, running, except when you have an open wound or have the poor circulation in the limb at the risk. At risk when flying in an airplane. If you do not have lymphedema, consider wearing a well-fitting compression garment that will cover the entire extremity including the finger and toes. When flying in an aeroplane, if you do have lymphatic edema, consider wrapping extra short stretch bandage over your existing compression garment. Also be sure that all exposed areas such as hands, we use a gantlet or bandage, or fingers, toes, use bandage are completely covered. Extreme temperatures. Avoid exposure to the extreme cold, which can be associated with the rebound, swelling, chapping of skin. Avoid prolonged exposure to heat, particularly hot tubs and saunas. Avoid placing limb in the water temperature above 102 degree Fahrenheit. Additional practice specific to the lower extremity lymphedema. Avoid prolonged standing, sitting or crossing legs. Wear proper well-fitting footwear and holstering. If you have any question about the prevention and how to reduce the lymphedema, you can ask me in the comment section. Thank you so much for watching and liking the video.